family members, trustees, faculty, alumni, and honored guests, today we celebrate the class of 2016, who, I know, have the resilience, courage, and determination to overcome life's greatest challenges. I also know that they have the creativity and intelligence to discover cures for our most serious diseases. And I am sure that they have the motivation to develop and participate in new models of healthcare designed to reduce inequities of the underserved. The class of 2016 consists of some of the best and brightest graduating medical students and scientists in the United States. The best. How can I make this assertion with confidence? Let me give you a few examples. The parents and grandparents of many of our graduates emigrated from countries around the world, often with little resources, working multiple jobs, giving their sons and daughters, our graduates, the resilience to achieve the American dream. I salute you. The family of one of our graduates all became citizens on the same day, a day they will never forget. Some of our graduates have risen from the scourge of poverty and inner city violence. Others have overcome family discord, even abuse, and the challenges of a single parent home. There are graduates in this room who experienced trauma and the stress of serious illness and even the death of parents, close family members, and friends. How did they get to this day of achievement and overcome all odds? They never gave up. They never gave up. The words of Maya Angelou ring true. You may encounter many defeats, but you must not be defeated. In fact, it may be necessary to encounter defeats so that you know who you are and you know what you can rise from. The class of 2016 is also the brightest. It's easy to make the case. How about the awards that they have received? Here's just a few. The American Medical Association Foundation Excellence in Leadership Award. The prestigious AAMC Herbert W. Nickens Award. The Center for Disease Control Global Health Fellowship. And a National Institute of Health Medical Research Scholarship. And these are only a few of the awards. They showed a commitment to the local and global community that is unrivaled. They founded the Medical Students for Haiti. They established the East Harlem Outreach Partnership National Consulting Service to help medical students from around the country set up free clinics to help the poor. Are they entrepreneurs? Yes. They have started multiple biomedical startup companies and a comic clinic, a group aimed at promoting both medical student and patient wellness through a shared love of art and storytelling. And the East Harlem Software Company, a startup which has developed web-based applications for clinicians to track important patient information and practice guidelines. In addition, many of our graduates have conducted research that have the potential to change the lives of millions of patients. Over 34 of our graduating medical students have a first author publication, and literally all of our graduating PhD students have the same. Here's some examples of the research findings of our graduates before you. They identified new therapeutic approaches to the most serious viral illnesses, possibly leading to new vaccines and antiviral drugs. They've developed novel therapeutic approaches for cancers, the most serious cancers that metastasize throughout the body. They've identified disease pathways and potential targets for new drugs for multiple sclerosis. and develop methods to screen and predict breast cancer in new mothers. And related to the problems of our time, characterize the impact of adolescent use of marijuana and other drugs, and relate that to the risk of developing psychiatric disorders. Let's all stand up and make some noise for our graduates and for those who helped them. Let's have the graduates stand up and thank you. Okay. Thank you. Thank you. Class of 2016, it's obvious that your achievements are impressive and your future is bright. But with these, my parting words to you, I wish to speak of important work yet to be done. I ask you to join your alma mater in making a commitment to embrace diversity, 360 degrees, as it relates to medical education, scientific research, and the delivery of clinical care. Racism in medicine still exists, but it is often only talked about at a very superficial level. Mount Sinai intends to lead the nation by providing a comprehensive education to our students, residents, and faculty on issues such as unconscious bias, social determinants of disease, and disparities in healthcare. A core value of our medical school from the day it was established was an unequivocal commitment to humanism and social justice. Similarly, Mount Sinai Hospital, which was founded in 1852, was founded on the principle of equal access to high-quality care for everybody. And currently, the Mount Sinai Health System has the responsibility and the privilege for providing health care to perhaps the most diverse population in the United States. You might ask, why is this so important? We know that on virtually every measure of health, racial and ethnic minorities fare worse than their white counterparts, from diabetes to heart disease to asthma to cancer to infant mortality. These disparities can be explained by factors such as lack of access to health care, poor nutrition, lack of exercise, and other things. But there are some other important factors that are at work. Studies indicate that relationships between patients and their physicians of the same race or ethnic group are characterized by higher levels of trust, patient satisfaction, and respect than their counterparts. That is not to say that physicians must be of the same race or ethnic background as their patients, but it does highlight the need to have a greater understanding of cultural diversity. Less known is the fact that many drugs have varying efficacy in groups with different ethnic and ancestral backgrounds. For example, some asthma medications are less effective in people who self-identify as African American or Hispanic. People who self-identify as Asian have a higher incidence of adverse drug effects from chemotherapy. And this problem is confounded by the fact that a focus on diversity in clinical research is still the exception and not the rule. Although ethnic minorities have greater rates of and mortality from serious diseases, they are generally less likely to be enrolled in clinical trials. Of the over 10,000 clinical trials funded by the National Cancer Institute since 1993, only about 150 trials focused on racial or ethnic minorities. Mount Sinai intends to be part of the solution. Our investigators will form partnerships with physicians and residents in underserved and underrepresented communities. We will emphasize increased recruitment of minority physicians and scientists. Remarkably, there is growing evidence that embracing diversity in all aspects is the key to breakthrough science. Diversity in this context means an inclusive approach, both to the science itself and to the makeup of the research teams that investigate the causes of disease. Decades of research indicate that socially diverse groups, that is, groups with a diversity of race, ethnicity, gender, and sexual orientation, are more creative and more innovative than homogeneous groups. Diversity in science brings together investigators who look at problems from different angles, contributing to a more complete understanding. Diversity balances biases that may inhibit scientific progress. It contributes to what is called the collective intelligence of the group. Most importantly, when individuals from underrepresented groups become scientists, they often choose scientific areas that will impact the people that they care most about. When science is inclusive, everybody wins. Long underserved communities are finally heard and helped. Class of 2016, I speak today of diversity because I need your commitment. Graduating physicians, will you embrace the diversity of your patients and understand that with diversity, there is beauty and there's strength? And I want you to lead the charge as advocates and activists to eliminate bias and health inequities in your local communities and around the world. Graduating scientists, will you embrace diversity in thought and in action? Will you encourage new ideas from all aspects of science and strive to make research discoveries that will help the underserved, diverse population? Class of 2016, I leave you with the advice of Harriet Tubman, the American abolitionist, humanitarian, and soon to be on the face of the $20 bill. Every great dream begins with a dreamer. Always remember that you have the strength, the patience, and the passion to reach for the stars to change the world. May your dreams come true, and may those of the patients we all serve. Thank you very much.